Seminar Series, Phase 3. I would like to thank the organizer of this weekly seminar series, Dr. Noman Rayat, lecturer in law in Leicester Law School, and the founder and convener of the Global South Network. And as always, today's panel is the most diverse panel. My name is Sabine Franklin. I am the Mellon Postdoctoral Fellow in Africana Studies at Wellesley College, which is in Wellesley, Massachusetts in the United States, and I will be chairing the session today. I am joined by Professor Rhona Smith from the School of Law at Newcastle University. Rhona is the co-convener of the Global South Network. Then we have Roua Taweel, the PhD candidate at the School of Law, University of Ulster, who is the peer commentator for today's session. And last but not least, our guest speaker for today's session is Christiana Barau, who is a senior magistrate with Niger State Judiciary, Nigeria. With over a decade of experience as a judge of the lower courts, she is currently a PhD student in the University of Ilorin, Roua State, Nigeria. She is the chairperson emeritus of the Federation of Women Lawyers, FIDA, in Nigeria in the Niger State Chapter. FIDA is an organization of women lawyers who fights for the rights of women and children. She is presently the financial secretary of the International Society of Public Law in Nigeria, and is also a member of the Institute of Chartered Mediators and Conciliators of Nigeria, and is also a member of the, and has served as a mediator for more than 3 years at the Niger State at the Multi-Door Courthouse. So Christiana, you have 30 to 35 minutes for the presentation, which will be followed by 5 minutes for comments and questions from the discussant and the peer commentator, and then 15 minutes of questions and answer session by attendees. So the floor is now yours.
I will start.
Sorry, I can't hear anything.
Christiana, can you, we can't hear you. Can you please double check your mic? We heard you for a while, for a little bit, but then we missed you. I think somehow you cut out in the middle.
Can you hear me now?
Yeah.
Yes, Christiana,
Yes,
we can hear
you.
you. And we can see your PowerPoint as well.
Okay. I say I would want to appreciate Dr. Newman for this opportunity and also thank everyone for being here. And I will also start with an apology. I will apologize for my lapses in advance because this is my first time of doing a presentation like this. As you have heard, I'm a judge. I'm not in the academic field. I'm just learning, but desirous of joining the academic field. So my seminar is on critical appraisal of the provisions of the disability law in Nigeria and the challenges of their implementation, a case study of Niger State, Nigeria. So after the ratification by the Nigerian government of the UN Convention on the Rights of People Living with Disability in 2010, Nigeria enacted the Discrimination Against Persons with Disability Law Act 2018, which came into effect in 2019. This law has been in existence for more than 5 years now, and yet there is little or no impact on the lives of persons living with disability. Still, people living with disability suffer significantly from discrimination, stigmatization, and exclusion in all spheres of the society. As at now, only 16 states and 36 states, out of 36 states, have domesticated the Discrimination Against Persons with Disability Act. And out of the 16 states, only 3 states have established the State Commission or National Commission for Persons with Disability. The law have made several provisions for the protection of the rights of persons living with disability. Like one of the provisions made by the law is the establishment of the commission. Is the establishment of the commission to protect the rights of persons living with disability. The law also have provided for a 5-year window period to allow public and private buildings to adjust their buildings in order to make it accessible for persons living with disability. It also provides for the establishment of a database to collect data of persons living with a disability to make the implementation of the law effective. And schools are also required to provide exclusive education for persons with disability by providing necessary facilities and accommodations, such as sign language interpreters, braille materials, and assistive devices. Healthcare facilities are required to provide accessible and affordable healthcare services to PWDs, that's people living with disabilities, by providing necessary equipment and trained personnel. The law also mandates the establishment of, next slide, please. Next slide. Sorry, not here. Is that the next slide, Dr. Newman?
Yes, it is next slide. Statement of problem.
Okay, the statement of the problem that the disability law in Nigeria was enacted in 2019 to protect the rights of persons with disability and promote their inclusion in all aspects of the society. However, several years after its enactment, people with disabilities still face numerous challenges, just as I've said before, including discrimination, stigmatization, and marginalization. The major challenge that the disability law faces is the lack of awareness among the public. Many people, including policymakers, stakeholders, and even the persons living with disability themselves, are unaware of this law, and the implementation becomes difficult because there is a lack of awareness on their part. Then another challenge is the lack of political will by the government to enforce the law. And women and children with disabilities continue to face numerous obstacles in accessing their rights in Niger State, Nigeria, due to their multiple marginalized identities. They are at risk of experiencing violence, discrimination, leading to lack of economic empowerment and social inclusion. Next slide, please. The aims and objectives of the study is to examine the provisions of the disability law in Nigeria and their relevance to the rights of women and children with disabilities, to identify the challenges faced and in the implementation of the disability law in Nigeria, also to ascertain the level of awareness and understanding of the disability law among women and children with disabilities. Another one, to explore the impact of the disability law on the lives of women and children with disabilities in Nigeria. Equally, to recommend strategies for improving the implementation of the disability law and promoting the rights of women and children with disabilities. Next slide. The methodology I'm using for this research will be qualitative. Sorry, the word there is quality, not is qualitative, not quality. It's a mistake. So it's a qualitative method comprising of doctrinal and non-doctrinal methods. The work will include both primary and secondary sources. The primary source will include statutes, codes, and case laws on the subject matter. Also, the work of scholars will be used as secondary sources. Then on the non-doctrinal source, we'll be interviewing stakeholders, some persons living with disabilities, especially the women and children, in order to have a broader view from their experience on the subject matter of the research work. Next slide. Prevalence of disability in Nigeria. According to WHO research in 2011, 15% of the population and equivalent to 36 million people are people living with disability in Nigeria. And this figure includes both visible and invisible disabilities, such as physical, sensory, intellectual, and mental impairments. The high prevalence of disability in Nigeria is attributed to various factors, including poverty, poor healthcare systems, inadequate infrastructure, and cultural beliefs that stigmatize people with disabilities. The majority of people with disabilities in Nigeria face significant barriers to accessing education, employment, and healthcare services, which further exacerbates their vulnerability and inclusion from the society. This survey was done by National Demographic and Health Care Survey in 2018, which put the prevalence among women and children under the visual impairment. The women have 1.10%, while the children have 1.40%. Under the hearing impairment, women have 1.10%, while the children have 1.10% also. The mobility impairment, 1.80 for women and 2.10 for children. Intellectual impairment, 1.10 for women and 1.10 for children also. Multiple impairments, 0.80 for women and 1.10 for children. The prevalence rates are based on the self-reported disability by individuals age 15 years and above for women and age 0 to 14 years for children, respectively. Multiple impairments refer to individuals with 2 or more types of disabilities. Under the law defines disability as the physical, sensory, intellectual, or mental impairment that substantially limits a person's ability to perform one or more major life activities. The law also recognizes persons with temporary disabilities and those who are at risk of becoming disabled. Next slide. Then the objectives of disability law in Nigeria. The objectives of the law, that's the Disability Law 2018, includes to promote and protect the rights of persons with disability. And 2, to the provision of equal opportunities and access to services, facilities, and programs for persons with disabilities. The promotion of inclusive education, employment, and social protection for persons with disabilities, and promotion of awareness and sensitization on disability issues. This agitation was done by the civil societies in Nigeria that brought about the enactment of the law. The rights of, these are some of the rights that are provided in the law, which recognizes the rights of persons with disability. They include the right to equal opportunities to access education, employment, healthcare, and other services. The right to reasonable accommodation to enable them to participate fully in the society. The right to protection from exploitation, abuse, and violence. The right to participate in decision-making processes that affect them. Then the right to privacy and confidentiality in relation to their disability. Also, right to access information in accessible formats, and right to reasonable adjustment in buildings and facilities to enable them to access them, and right to be treated with dignity and respect. All these rights are expected to be enforced by the National Commission for Persons Living with Disability established. Next slide. Then, owing to the challenges of the implementation, as I've earlier said, the law has been in existence for more than 5 years, and little or nothing has been done to impact on the lives of persons living with disability. And looking at some of the challenges that I've outlined here, I say lack of political will and commitment lack of political will, and commitment from relevant authorities. Then inadequate funding and resources for disability programs and services, poor awareness and understanding of disability issues among the general public and policymakers. As it is now, even the budget, the recently passed budget, is little or nothing. There's little or nothing allocated to the National Commission for Persons Living with Disability. So carrying out programs that will affect or impact on the lives of persons living with disability definitely will be difficult. And these are one of the challenges that I believe is preventing the implementation of the law. Then inadequate infrastructure and accessibility for persons with disabilities in public places and buildings. I earlier said that in the law, there's provision for 5 years window period availed to public and private buildings to adjust their buildings to make it accessible for persons with disability. And as it is now, I believe most of the buildings have not complied, or most of the private organizations, even the government, most of the buildings have not complied with that mandate. Only the new buildings are complying with the mandates, but the old buildings are still as they are, without accessibility for persons living with disability. The limited access to education, employment, and other opportunities and for PEWDs. Mostly employers are reluctant or unwilling to employ persons with disability, despite that the law provides that 5% slots should be made available by private and public enterprises for employment of persons living with disability. This, we have seen little or nothing done in that aspect, just a few. Then stigma and prejudice against persons with disability in society, which hinder their social inclusion and participation in community life. Definitely, there is a lot of stigma attached to persons with disability. Even from the immediate family of these persons, they are faced with stigma and discrimination. So these are some of the challenges of persons living with disability. Next slide, please. Sorry. Then some challenges are specifically affecting women and children, which are lack of awareness and understanding about disability rights among women and children themselves, as well as among their family members, because they are faced with more harm and violation of rights, being women in the first place and being disabled in the second aspect. Then stigma and prejudice against women and children with disabilities, which can lead to social isolation and exclusion from education, employment, and other opportunities. There is also inadequate funding, just as I've earlier stated, that there's inadequate funding of programs and services that has to do with rehabilitation, training, and accommodation of persons living with disability. And also there's a limited availability of assistive devices and technologies that are appropriate for women and children with disabilities, which can impede their mobility, communication, and other functions, other functional abilities. Sorry, next slide, please. And one of the challenges also, let me, talking about the challenges still, the National Commission that is saddled with the responsibility of protecting, also into the implementation of the law. The commission itself was inaugurated sometimes in 2020 and did not even take effect till 2021. And even at that, we have just a quarter of the states that have domesticated the law. And out of the quarter, just 3 have established the commission in their various states. Definitely, which means that there is, they have not taken up, the commission have not taken responsibility of implementing the laws in their various states. That's the states that have domesticated the laws. Then challenges in implementing the disability law. Sorry, the next slide, sorry. And strategies for addressing challenges in implementing the disability law for women and children. As we have seen the challenges faced for the challenges stopping the implementation of the law, then I look at the strategies that can be used to address the challenges in implementing the disability law. And some of the challenges I came up with is increase awareness about disability rights through education, campaigns targeted at women and children, families, communities, employers, and service providers. They need to be educated on the rights of persons living with disability. Then promoting social inclusion through community-based rehabilitation programs that provide support for women and children with disabilities to participate fully in the communities. Also, they can provide financial assistance through the National Fund for Persons with Disabilities to cover the cost of rehabilitation, training, assistive devices, and other supports needed by women and children with disabilities. Then to also enhance accessibility through policies that require all new public buildings to be designed and with accessibility features. That's to make it mandatory for all public buildings to have accessibility for persons with disability, just as stated in the law. Then encourage employers to provide reasonable accommodation for women and children with disabilities in employment settings through policies that require them to do so. That's not just employing them in their organizations, but to take further step in providing accommodation for them. It will go a long way in impacting on the lives of people living with disability, especially for women and children. Next slide. Then collaborative efforts. For the effective implementation of this law, there is need for collaboration between the government, the stakeholders, MDAs, the CSOs, and the organization of persons living with disabilities themselves. I said the National Commission for Persons with Disabilities are responsible for coordinating disability policies, programs, and services at the national level. Then we have the one at the state level. If those states domesticate their laws, they are also expected to set up the commission that will be saddled with the responsibility of coordinating the policies and programs for persons with disability. Then the ministries and departments, agencies are also responsible to ensure compliance with the provisions of the law and standards in their respective sectors. And also civil societies are responsible to advocate and for advocacy, capacity building, and monitoring compliance, and also sensitization. Civil societies can do that to sensitize the public, advocacy on more laws that can make the law more effective. This will go a long way in seeing to the effective implementation of the law. Then private sector organizations, They are responsible for promoting accessibility and inclusion of persons with disability in products, services, and workplaces. And persons with disabilities themselves are also responsible to participate actively in decision-making processes related to disability issues. They are expected to participate in decision-making by making themselves available to to government programs and programs that have to do with issues of disability. Next slide. These are, I've stated this before. These are examples only. Next slide, please. Responsibilities of persons with disability. The persons with disability, they have responsibility to make this law effective or to make life even more accommodating and the law also places a responsibility on persons with disability themselves, such as responsibility to provide information about their disability where necessary. Then responsibility to take reasonable steps to mitigate the impact of their disability on their daily lives. They can take up skills that will impact on their lives and will aid them in providing for their day-to-day living. Then responsibility to cooperate with service providers and other stakeholders in implementing reasonable accommodations. As it is, most of persons living with disability, especially in Niger State, are littered in the street. They prefer begging for alms to fend for themselves. So getting accommodation for them might be a difficult issue because they are comfortable with the life of begging for alms. So getting them to accommodated in a safe place might be an issue. So they have the responsibility of cooperating with service providers when accommodation is being provided for them, so that they can be in a safe accommodation and conducive atmosphere. Then responsibility to respect the rights of persons with disability among themselves. There are cases of violence among themselves, especially sexual violence, rape by either family members or community members among themselves. So they have that right to respect their rights. Next. Responsibility of service providers. The service providers are responsible to provide adequate accommodations for persons with disability. They also are responsible to provide assistive devices and technologies where necessary, and also to provide training for their staff on how to interact effectively with persons with disability, because that's the challenge of persons with disability when they access health care. Most at times, the health care providers are unable to communicate effectively with persons with disability. So if these service providers can train their staff to be able to communicate effectively with the persons with disability, to go a long way in impacting on their lives. Then ensuring that buildings and facilities are accessible for persons with disability. The healthcare providers are also have this responsibility to make sure that their buildings are accessible to PWDs. Next slide. Then conclusion. A call to action for stakeholders, including persons with disability themselves, to familiarize themselves with the provisions of the disability law in Nigeria and work together to promote equality, dignity, and independence for persons with disability. To also overcome these challenges, there is a need for increased funding for disability programs and services, increase awareness campaigns that specifically address barriers faced by women and children with disability, and sensitization of relevant stakeholders on their roles and responsibility under the disability law to ensure full participation of women and children with disabilities in the society. The last slide. Then recommendation. These are some of the recommendations I outlined. One, increase awareness and sensitization on disability issues among women and children with disabilities and their families, communities through targeted programs, campaigns that address gender and age disparities in disability rights implementation. Then enhance provision to reasonable accommodation for women and children with disabilities in public places, transportation and other services, facilities through collaboration between government agencies, private organizations and community for their safety. Then promotion of inclusion, inclusive education, employment and social protection programs for women and children with disabilities through targeted policies, programs that address gender and age disparities in disability rights implementation. Also, increase participation of women and children with disabilities in decision-making processes at all levels through provision of support, resources for their involvement, including training, mentoring, networking opportunities, and presentation in decision-making bodies. They can be trained in skills that is peculiar to their various disabilities. Then regular monitoring and evaluation of the implementation of the disability law in Nigeria to identify gaps, challenges, and opportunities for improvement, as well as to ensure accountability for compliance with the law. Actually, the work is a work in progress, but this is what I have. Thank you.
Thank you, Christiana, for this great presentation on the implementation of disability law for women and children in Niger. So I would like to turn the floor now to our discussant, Professor Rhona Smith.
Thank you very much indeed, also from me, for a very comprehensive review and overview of the subject, which is obviously very important, but also very difficult because there's been a lot that's been done on this kind of area all around the world, and it remains a big problem trying to ensure that the rights of persons with disability are fully respected and are given effect to in a number of different countries. Nigeria has many challenges, as you've outlined, but it's certainly not the only country in that position. I think you've been very thorough in your presentation of kind of mapping out the main problem that you see and also mapping out a number of the challenges, both with the law and also with the implementation of the law in Nigeria, which is obviously your main topic. In terms of questions or comments, I've probably got a few that I would like to put forward for you to consider. I suppose, firstly, many of the aspects that you've written just now and that you've identified are quite standard for a number of different laws in countries, particularly those giving effect to human rights. So the lack of funding to support measures, the lack of awareness, the problems of stigma for people, and the big issue of political will. I mean, I think that's quite prevalent, not only for rights of persons with disability, but also rights in general in much of the world at the moment. And I suppose one of my questions would be, with respect to the kind of policy responses and strategies you outline in your recommendations, how realistic do you think they actually are? So you've made a number of very good recommendations. So my question is, how realistic and practical are they? A second question I have is, with respect to the law in Nigeria, I wonder whether one of the challenges on that law is the terminology used, particularly for those with mental disabilities, because they talk about mental impairment and they use language in the law in Nigeria, which has been critiqued in, for example, the United Nations, and it's often deemed that the Nigerian law, while trying to do something good, is quite negative in terms of the language it actually uses for persons with disabilities. So I just wondered if you had any comment on that. My third question is, I wonder if you could elaborate a little bit on your plans for the qualitative aspect of your research, which involves interviews, because it would be interesting to understand how that's working out and going to work. I'm not sure if you've done them now or not, but just to understand a little bit more about your thoughts on the qualitative interviews with different stakeholders, because that would certainly be quite an unusual aspect, because it's a difficult group sometimes to get responses from. And my fourth and final point is I just wondered whether you had looked at the UN Convention on the Rights of Persons with Disability, as this is something which Nigeria ratified in 2010. I've also supervised various PhDs on it, so I've got some of the background on how that worked. And Nigeria put in their first report to the UN committee on 2021. So it might be useful, if you've not looked at it, to have a look at that report, because that's obviously the government's view on some of the challenges, and I expect there will also be some shadow reports forthcoming which aren't yet published. So that's my kind of 4 points perhaps to look at in the first instance. Thank you.
Okay, thank you. On the recommendation, I would say with collaborative efforts of stakeholders, I believe the recommendations will be quite effective. They will be effective with collaborative efforts of stakeholders, that's the CSOs, civil society organizations, the private sector, and the government. With all their hands put on deck, the recommendations will be effective. And on the Rhona report, I have not actually looked at it, but I will do that. As I said, it's a work in progress. I will look into it. Then the qualitative methodology, that's the interviews. Actually, I have worked and have been working with some groups of persons with disability, that's their association. I work with Leprosy Mission, and I have contact with most of these people living with disability. So getting interview with them will not be a difficult issue for me. I can't remember the fourth question.
Mm-hmm.
I think
on the qualitative, so that's one group that you've got identified. So are you planning to do like one-to-one interviews with the groups that are helping support or representing persons with disability? Or are you planning also on talking to some of the actual persons with disability?
Yes, I'm planning to have an interview with some of them that are actually living with disability. Mm-hmm. Then interviews with some stakeholders like the Leprosy Mission that work directly with them. Then with some CSOs that work directly with persons with disability, and some government officials, especially the House of Representatives, the House of Assembly members.
Mm-hmm. Okay, thank you. No, it's just to understand, because it's obviously interesting just to know what your plans are with that. So thank you.
Okay. Well, thank you, Professor Smith, again for being our discussant. Before I turn it over to our peer commentator, I would just like to check to see if any members of the audience have any questions or comments. Oops, okay. All right, then. So we'll move on to our peer commentator, Dr. Taweel. So the floor is yours.
Hi, sorry, I'm still doing my PhD. Hoping
No worries,
to get to be doctor. Okay, thank you very much, Christiana, for the incredibly important research project. I approached your research with great interest, especially for its intersectional approach, the intersection of gender and disability, addressing the often overlooked experiences of women. Your research also highlights the critical gap between legal frameworks and their application, showing that in so much as legal reforms are essential, laws on their own are not enough to tackle the complex problems of inclusion and discrimination faced by different social groups. So this recognition reinforces the argument for a comprehensive approach, as you rightly mentioned during your presentation. Your presentation prompted some questions I hope to share with you, like knowing that you might have already answers for these and couldn't find maybe place in the limited time and space we usually have for abstract and PowerPoint presentations. And also acknowledging that there is always disadvantage and advantage of external eye. So I hope some of these would stimulate at least reflection and discussion. I group these in terms of theme, content, and in terms of methods and analysis framework. So in terms of methodology and analysis, I was really interested to learn about your reflection on your positionality besides your expertise as a judge concerning the research topic and in relation to the research participants. I thought it might be useful to consider elaborating on your sampling techniques, as already our discussant Rhona mentioned, and ethics consideration, especially given the vulnerabilities associated with the affected population you're interviewing. I'm also curious to whether your analysis shed lights on specific differences between the experiences of women versus men of disabilities, and equally whether you consider or plan to consider the dynamics between the different departments, institutions, or bodies you outlined who are responsible, like somehow the collaboration politics, if I may call it this way. In terms of the theme itself, mostly related to the context, because it's not, maybe because also it's not something that I'm engaging with in my research. I was curious about potentially additional legal provisions and instruments, both binding and non-binding, that could further support argument for state compliance and accountability. For example, the available regional instruments in Africa, or like given your focus on women and children, then there are international instruments related to gender equality and or children rights might be useful to contribute or like show how the absence of such support impacts other obligations as well. I also wondered about any link between disability and episodes of conflicts, or COVID-19 for that matter, considering the law is relatively new and was enforced right after the pandemic hit. Also, despite awareness gap of existing laws, you mentioned, I'm curious to whether you identify or explore the channel available for individuals to lodge complaints and seek justice if they are aware, if they happen to be aware of their rights. And lastly, whether in the literature or your fieldwork, it can be useful to address the lack of political will and indifference by arguing the cost associated with not addressing these issues. That's it. That's all from me. Please ignore anything of no relevance to your research. Your work addresses important issues with great potential for positive impact. I wish you all the best and look forward to following your progress. Thanks.
Thank you very much. Just as I said, it's a work in progress, and I'll taking note of all the comments and I will work on them. I will include them in the research. Thank you.
Thank you. And so we're now moving to the phase of where we're taking comments and questions from the audience. I actually do have a comment/question So I'll go first. Christiana, I was wondering, since disability is such a broad category and there are different types of disability, as you mentioned in your slide, the visual, hearing, mobility issues, intellectual issues, do you see perhaps institutions or service providers maybe more willing to cater to one type of disability versus another types of disability? So the reason why I'm asking this is because I'm thinking about, like here in the States, you know, to be what we call ADA compliant, which is our disability law. You know, a restaurant or a building would have to do significant infrastructure upgrade, like changes to the bathroom, adding ramp, these type of projects, which could be very expensive. However, to cater to, say, someone who's visually impaired is a lot less cheaper, right? You just have to put up Braille signs, and that's fairly easy to do, as opposed to having to cater to someone who has, who's in a wheelchair or have a mobility issue, right? Or, to put in an elevator versus someone who's hearing impaired and just putting in a telephonic system, which again would be a lot cheaper to do. So I don't know if you could speak to that, if you're seeing that in Nigeria, or I guess perhaps if you would consider that when you actually do your field work.
Yes, we actually consider that when I'm as the work progresses, but I actually see the service providers making preference for other cheaper assistive devices. That's providing services for persons with disability that have cheaper assistive devices due to lack of adequate funding. So I see them making that preference too, but we also consider that as the work progresses.
Okay, thank you. And just to kind of piggyback on that, based on the law in Nigeria, so if they are, I guess, making some, providing some services to people with some disabilities, then does that mean they're actually fulfilling the law, or they're compliant with the law, or would they have to go much further?
The major challenge here is the funding. The major challenge is the funding and also lack of political will. If even if the service providers are willing to provide these services to the PWDs, there is still this challenge of lack of funding. Because as I said, I work with leprosy mission at times. In their work, I join them to do some sensitization. So we go to these hospitals. Actually, there are service providers willing to assist, but because of lack of funding, no equipment, no assistive devices, they are limited in the services they provide people with disability.
All right, thank you for that, Christiana. I do see a comment here in the chat from Jorge Gasiola. He says, I would love to hear about the specific challenges to satisfy the rights of persons with intellectual and mental disabilities in Nigeria. Would you be able to speak to that, Christiana?
Sorry?
The comment from Jorge Gasiola in the chat, he asked that he would like to hear about the specific challenges to satisfy the rights of persons with intellectual and mental disabilities in Nigeria.
The challenges again is funding and also personnel on ground. The personnel to actually address people with mental impairment or intellectual impairment. the challenge actually, the big challenge is the funding. And the bigger one is the political will, because if there's political will, the funding will not be a challenge. But this lack of political will and also funding is the bigger challenge, providing services for people with intellectual impairment.
Okay, thank you. And I see two hands raised up. The first is from Ebenezer Adodo.
Yes, good afternoon, everyone. Thank you very much, Christiana, for your very informative and insightful paper. I have a quick question. How the police, how are they, how willing are the police to prosecute suspected cases of government bodies or persons in private sector who discriminate against people with disability? For example, if you have got a disabled invited to an interview and is unable to make the interview because of his circumstances, and he wishes to take the interview, the interviewer to court. So is the police willing to prosecute such persons who are suspected of having violated the rights of the disabled?
Generally, we all know the issues with police prosecutors, but if the National Commission for Persons Living with Disability is established and is put in place, I believe this will not be a challenge because they are responsible for coordinating and protecting these rights. If there are people monitoring this, because once the commission is in place, they will be the ones that will follow up the case. They will be the ones to report the case and also follow up the case and make sure that the police take up the prosecution and follow it up to the latter. And also CSOs, that's the civil society organizations. That's why I talked about collaboration. If there is an issue of this nature, the CSOs are on ground, the commission is on ground, all of them collaborating together. I think the police will have no choice than to prosecute violators.
Okay, thank you very much. Sabine, if you probably permit me, I wanted to have a quick, a follow-up comment or probably question. Whether in your experience, Christiana, whether in your experience, as a matter of culture, the general people, the general public, whether they are willing to extend that compassion to those who are with disability. Because sometimes to make the law work, it requires some cultural willingness on the part of the people to actually accommodate the changes that are supposed to be put in place. So are the people generally, are they willing, as a matter of your experience, are the people generally willing to extend their hands of fellowship to those people with disability? Do people generally discriminate against them, or that they are more welcoming?
No, I mentioned it. I said they face discrimination even within the family members and the community. So discrimination is, or stigmatization is prevalent within the community, and they are not willing, actually. They are not willing. And as I said,
about that.
Sorry?
No, I'm sorry that to hear that,
Yes. In fact, the willingness on the part of the community is very low. And also, even among the people living with disability themselves, their cooperation among them is also very low. Because as I said, they are comfortable with their lives on the street. That's the life of begging for alms.
Thank you, Christiana, and thank you, Dr. Adodo, for your question. I do have one last question here from Dixon Ternongo, who has been waiting patiently to ask this. Dixon, are you still with us? Dixon?
Yes, I'm here. Can you hear me?
Yes, yes.
Okay, yes. My name is Dixon Tanongo. Coincidentally, I'm from Nigeria, and I'm also researching on disability rights in Leicester here. The topic of my dissertation, my PhD work is Prohibition Discrimination Against Persons with Disabilities, a critical review of the legal and policy framework on the right of persons with disabilities in Nigeria. Christiana does an awesome presentation, I must say. Going forward, the question is, I heard you say two things which I want to make comment about. That is, you said persons with disabilities in Nigeria are more comfortable with begging than doing other things. I am a disabled. I am a person with disability myself, and I want you to. Can I finish?
Okay, okay. Sorry.
Yeah. Yes. As I was saying, you mentioned that persons with disabilities in Nigeria are comfortable with begging. I wanted to ask, don't you think that's the only option they have? That is one. And the second question is, already there's a 5 years transition for the Disability Act. And I'm sure you know this, the 5 years transition period is over. Don't you think? Okay, so what do you think can be done? I am of the view that the law does not activate itself. It's behold on us, persons with disabilities who feel our rights are being infringed, to actually go to court and begin to demand for the proper implementation of those legislation, because time is due, the transition period is over, and now time for action. And for me, action entails going to court and asking for the enforcement of those rights. What do you think?
In a way, I feel I think that's the option. That's the only option they have. And in another way, as I interrupted you earlier, I was talking about specifically about persons with disability in Niger State. So in another way, because I'm privy to arrangement one time by the government for an accommodation, most of those that were those on the street, and most of them were running away. They were not willing to come into the accommodation. There was accommodation provided for them where they will be catered for, but most of them were not willing to come into the accommodation because they feel once they are in the accommodation, they will not have access to the street where they can get money, extra money. So in a way, that's the option they have. And in another way, they are also unwilling to be accommodated. But still, the government can still do more by enforcing the, if they make a law that these people must be accommodated, they can enforce that law. Make sure they take them out of the street. And whenever any of them is found on the street, maybe the person will be prosecuted or something like that.
Thank you, Christiana, for answering that. And thank you, Dixon, for your important question. So we are going to have to end it right here. Christiana, I just wanted to let you know you had some comments in the chat that you can follow up with afterwards, including from Professor Smith regarding that the UN has a special rapporteur that specifically focuses on leprosy, if you wanted to know more about that. So I also want to thank you all for being here and today to hear Christiana's presentation. And I want to encourage you to attend the next seminar, which is titled The Judicial Treatment of Incapable Adults Before the Probate Courts in Egypt in Al Muhammad Journal, a research into the positivization of the Hanafi doctrine by Aya Berjami, PhD student at Bordeaux University in France. And that will take place next Wednesday, same time, 2 p.m. UK, 9 a.m. Eastern time, 7th of February. Thank you all and have a good day.